Um, Good evening, everyone, and welcome to ATP Live Monday. I hope you can see me and you can hear me. All right, so welcome to ATP Live Monday. I am Bemisola Boyde. I'm a pediatrician, and I'm here today to answer any questions that you may have about the health of your children in the next 1 hour. So feel free to start to drop your questions in the comment section, whether you're watching on Facebook or Instagram Live. I can see those of you on Instagram or YouTube. You're all welcome. But before we start to answer the questions, I'm just going to share the videos and make sure they are all pinned. So I want you to help me do the same. So just help us share the video to all your platforms anywhere you can share a video to. So you're welcome to do that. And I'm also going to just share the same so that everybody can see and everybody can hear us. So welcome everyone. I hope you've had a lovely day so far. Monday's actually busy days, but hopefully everybody is having a good day. All right, so welcome to ATP Live Monday. I'm just trying to share the videos to all the other groups and so that everybody can see and everybody can hear. So we have an hour to answer any questions that you have about the health of your children. So please start to drop your questions as you're joining us. Start to drop your questions. Please always start every question with the age of the child. It's very, very important for us to know the age of the child. And please try and be very specific with your questions and go straight to the point. Don't just tell us information and no questions. So you have to be very specific with what you want us to do with whatever information that you provide. Unfortunately, because you won't be able to post pictures and stuff like that as comments, we will not be able to answer questions on rashes and all that. But if you have such questions, feel free to head over to our Facebook group and then you can post such questions in the group and with your pictures, and we will also get to answer them. If you are watching the recording, in other words, you're not watching at 6 p.m. on Monday, Nigerian time, then that means you're watching a recording. Then you cannot post your question at that time. You have to go to the Facebook group. Our groups are open Mondays to Saturdays, and we're able to answer your questions on our group. So even though this is an hour live session, you still have opportunity to ask questions beyond this live session on our Ask the Pediatrician Facebook group or ACP Family for Adult Health Issues. So I think those are my announcement, and I think I'm almost done with all the sharing and pinning, and then we are good to go. So please start to drop your questions, and we'll be able to answer them. Thursday this week, the 20th of April. Is it Thursday or Wednesday? Yeah, I think it's going to be Wednesday actually. But on Thursday, we're going to be having a presentation by a dentist as we celebrate the World Oral Health Day. So I look forward to that. Dr. Bukela to see our consultant dental surgeon will be doing the ATP hour in celebration of the World Oral Health Day. All right, I guess I'm done with all my sharing and all my pinning. Okay, but I can't see any questions yet. So once again, welcome to ATP Live Monday, and feel free to drop your questions on any health issues. Okay, I think I have one question on Instagram. I think I'm just going to take off my glasses so I can see very well. Okay, so glittering jewelries say in the absence of the cerebellum, is that the same thing as cerebellar palsy? Okay, we don't tend to use the term cerebellar palsy. We don't. I'm not sure we ever use that terminology per se. Okay, so but if a child has a congenital malformation and the cerebellum is absent, there are certain issues that child will have. So that child needs to be under a pediatric neurologist. And so you can see the child. So we use the term cerebral palsy. We don't say cerebellar palsy. We don't use that terminology. And cerebral palsy is not the same thing as absence of the cerebellum. So cerebral palsy has to do with the brain. Of course, cerebellum is part of the brain. We call it the hindbrain. And so even in cerebral palsy, there can be issues within the cerebellum itself. And such children tend to have what we call ataxic kind of cerebral palsy. I don't want to go into big terminologies and all that, but I don't think you should worry yourself about terminologies. Or let's just say cerebral palsy is not the same thing as cerebellar palsy. And a child who has no cerebellum, we don't call it cerebellar palsy. It's a congenital malformation of the brain with absent cerebellum. That is what we're going to say. And the most important thing is supporting that child development wise. That child will need support from the neurologist. So I hope that's help. But if you want to let me know what is your main concern beyond the terminologies, you can free to ask. All right. So I think we've answered glittering jewelry, but see you've asked the same question twice, but it's the same answer. All right, so Chomsy296. My baby of 2 months old has cough and catarrh. Siblings actually have the same, so the baby most likely got it from the siblings. Um, Please, can I give him any cough syrup? No, no cough syrup for a 2 month old. No cough syrup generally for babies below the age of 1 year. Don't give them any cough syrup. What you should have done is to actually prevent it in the first instance by keeping the baby away from those who are coughing and having catarrh. That's all you should have done. But if baby already has it, luckily most of them are due to viruses. They are going to go on their own. You don't need to treat it. They don't need drugs. They don't need antibiotics. So just leave it alone. What you need to do for your 2 months old is to keep breastfeeding the baby exclusively, keep the baby warm, pay attention to hygiene, hand washing, and all that. You remember all those things we're doing during COVID? The same thing we do as well. And but if the child start having fever, if the child is coughing, breathing fast, then that is when you will need to take the child to see a pediatrician. So if the child is coughing, having fast or difficulties with breathing, high fever, those are signs of possible pneumonia or bacterial infections, and those are the ones that require antibiotics. Those are the ones that you need to take to the hospital. But if the child is just having the catarrh alone, just leave it alone. Most of them will resolve within 2 weeks, so you don't need to give any other treatment for that. I hope that's helpful. But please do not give cough syrup. We really don't like mothers giving cough syrup to babies. Cough syrup do not treat the infections. Cough syrup actually medication that suppress the coughing. Okay, so but it doesn't deal with whatever is going on underneath there. So, and because children needs to breathe, most of those medication they give as cough syrup, they actually slows down breathing, and that is can be very dangerous in children. So we really don't want to suppressing children's cough or their breathing. It's okay for them to cough. It's more important for them to cough and for us to know if the cough is getting worse or if the child is having fast breathing or difficulty with breathing, so we can deal with this rather than thinking you're suppressing it. And then the child is actually having something sinister going on and nobody knows because they think they're already treating it with cough syrup. So no cough syrup to children below the age of 2, really. We don't want them taking cough syrup. So if they have cough, if it's cough with catarrh alone, most of them will go on their own. You don't need to do anything. If the child is having cough and there's difficulty fast breathing with fever, that's more likely going to be pneumonia. You have to take them to the hospital to see a pediatrician, and then they can treat the child properly. All right. Let me just take one more question on Instagram, then we'll come to Facebook. Tight Lulu, I think. Good evening. I think this is a blessing. Oh, thank you. I just saw my daughter's earring in her pool today. Congratulations. And it's been lost since Saturday. How old is your daughter? I found a earring in a pool. You didn't tell us the age of your baby, but please, please, mothers, even though I'm happy for you that your baby has passed out the earring in the stool, but that should not have happened. Your baby should not have swallowed the earrings in the first instance, okay? We really need to make sure that we keep small bits of toys, earrings, stuff like that. We keep them away from children. This is why when you see all these toys that have small bits, they always say not for children below the age of 3 years. It is very important that we don't allow children to play with things that they can swallow, because children usually between the age of 1 to 0 to 2 to 3, everything goes in their mouth. Once you give them something, is going in their mouth, and if it's a small bit, they can swallow it. And if it's something like dangerous that has hooks and all that, like I don't know the kind of earrings you have, it can puncture, it can damage organs in the process. So please, this should not even have happened in the first instance, okay? And you didn't even know this child swallowed it, so you were not even looking for it. Luckily, you now find it in the pool. I mean, like, I don't know how many days after. So please, let's be very, very careful. It is our responsibility to make sure that our children do not swallow things that are, that they can swallow. I mean, they should not be swallowing toys, earrings, and all that. We should not be allowing them to play with it. We should be very, very careful. All right. So you didn't tell us the age of your child, but I hope whenever you're asking any question, please always tell us the age of your child. That's very important. But that should not have happened at all. So if your child is fine, you don't need to go to the hospital for that. If the child has passed out the stool and the child is fine, you don't need to do anything about that. All right, let me just conclude glittering question because she just provided additional information. Your child is not yet crawling at 10 months. He sometimes folds designs. He grabs item closer and he he sits where we put him to see, but he's yet to start. Okay, so did your child has an MRI that shows that there's absence of the cerebellum? That is number one question I need to ask you. So your child has developmental delay, which is not unexpected if the child does not have some part of the brain. So that is not unexpected. But like I told you earlier, your child needs to be under a neurologist. That is the job of the neurologist. So if your child has developmental delay, that child should be seeing neurologists, that child should be having physiotherapy, and they should be having a conversation with you on what to expect because of that problem that your child has. So your child may have cerebral palsy. Cerebral palsy is different from cerebellar, which is the word, unless you are the one that you're maybe you're not sure of the spelling, but cerebral palsy, if that's the question you want to ask, which is what you're asking about child with developmental delay. Every developmental delay is not cerebral palsy. For cerebral palsy, there must be what we call disorder of movement and posture. So a child may have developmental delay and may not necessarily have cerebral palsy, but there are other things that we have to see before we can say it's cerebral palsy. So but just because this is not something we can address on this kind of a platform, but your child needs to be seeing a pediatric neurologist, and you should be going for regular follow-ups. That's what I will say about that child and leave it there. All right, let's just consider. Let me come to Facebook so that Facebook will not get upset. All right, Isifo Langa. When does baby start to have teeth? Okay, maybe most babies will start to have their first set of teeth between the ages of 5 to 7 months. However, babies can be born with teeth. So babies can have teeth in the first month of life. So it is still something that can happen. But averagely, majority of babies will start having their first set of teeth between 5 to 7 months. It is very important for us to understand when we say averagely, it does not mean it has to be exactly on that day. So maybe it will even have their teeth before 5 months. Some will have it, some may not have their teeth until 1 year, and it is still normal. So normal can be very, varied. There's a wide variation, but majority. So when we say 5 to 7 months, we are talking about 50% of babies most likely will do it around 5 to 7 months. But it is possible for babies to have their teeth before. Some are even born with their teeth, and some will not have their first set of teeth until 1 year. So your baby is 7 months, has no teeth, it's not a problem. Some babies do not have their teeth until 1 year. But the dentist wants you to see them when your baby is 1 year old. Teeth or no teeth, you should see a dentist when your baby is 1 year old. All right, Shukuras, good evening. Please, what causes dry throats in adults? I'm a pediatrician, so I'm going to abide by my calling. I don't know what you meant by dry throat in the first instance. So if your throat is dry, drink a lot of water, drink something to to make your throat wet, I think. But if you are not sure or it's not getting better, then obviously you need to see your a doctor. Someone's going to say pediatrician, but please see your doctors. When can someone use for a baby scratching his skin without rashes? I think the most important thing is to know why the baby is scratching the skin first. So that is the most important thing to know. It is not about um some of us parents, we always want to jump to what can I do, what can I use, what can no, we doctors don't start that way. We start with why is this child doing this? Because actually sometimes some things don't require you to do anything. Something just require you to stop what is causing it. So for example, if your child is itching from allergy, maybe because you are giving something, or maybe it's even the cream or the soap or whatever you are using that is making the child to itch, and that is an allergic reaction. All you need to do is not to apply anything. All you need to do is to stop what you're applying to the skin that is making the child to itch. That is all. You don't need to always do something. Sometimes you just need to stop doing something, actually. So what you need to do in this instance is to know why this child is itching. And when you go see the doctors and they know why the child is itching, then they can now tell you what to do. So there are many reasons why a child could be itching their body. Apart from having skin rashes, like I said, some children have allergic reaction to things and all that. So what is making them to react? That's what we need to figure out first, and that's what we need to deal with. So if we are not sure what it is that's making the child to itch, then you have to see a pediatrician, and then they will ask you loads of questions, and then they will work it out. All right, let's ask one more question on Facebook, then I go back to Instagram because my Instagram questions can disappear. All right, Musuraya, Homoshalewa, Ogonshala, good evening. My son took measles on Wednesday, immunization on Wednesday, but had high temperature on Saturday and Sunday overnight with thick greenish mucus coming from his nostrils. Can the immunization be the cause? No. So immunization, if it's going to cause fever, it will happen on Wednesday, not on Saturday or Sunday. And obviously the mucus in the nose and all that has nothing to do with measles at all. So do you need to take him to the hospital? Yes. If the child is having fever, have you given paracetamol? Today is Monday. So it's happened, it says Saturday stroke Sunday, so that's 2 days. What's the temperature level? Have you checked the temperature? Have you given the paracetamol? So if the child is not getting better, definitely yes, you have to go to the hospital. The temperature is back to normal. Okay, if temperature is back to normal, then you can just watch. You don't need to rush to the hospital if the fever is gone. Is immunization complete? No. How old is your baby? You didn't tell us the age of your baby. Oh. All right. Always start the question with the age of your baby. I can't know whether your baby's immunization is complete when you didn't tell me the age of the child. But there are immunization at 15 months, and now we've added the what's it called, HPV vaccine, which is available at 9 years now for girls. So you have to always tell us the age of your child for you to make sense. So if you didn't tell me the age of your child, there are two measles vaccines. So there's measles vaccine of 9 months, there's measles vaccine of 15 months. So I don't know whether what you did was Mrs. 1 or Mrs. 2. So it's very difficult for me to answer that question. So if your baby is 15 months, then according to the Nigerian program on immunization, that is the initial end. But there are immunization beyond 15 months, and there are immunization your baby can take that are not even on the national program, that are not free, that you have to pay for if you want to do it. So let me stop there. But if you have additional information, feel free to have it. Okay, let me quickly answer Instagram because the questions can disappear. The Lulu, I'm not so sure I got this. Okay. Okay, Tyler, the baby that swallowed earring is 11 months old. The caregiver was careless. Okay, I'm not. I'll reserve my comments on that. You don't need to go to the hospital. Your baby is fine. Just I've already answered your question. If your baby is sick, when you initially started, you started with your baby swallow earring, pass earring in the stool, and you were asked whether you can go to the hospital. The answer is no. You don't need to go to the hospital. Baby already passed the earring and baby is fine. But now you are telling us that your child has fever, has been cranky, and then you have to go to the hospital for the fever and your baby being cranky. That is a separate condition from the hearing issue completely. And I'm not the one to tell your doctors what tests to do. So when you get to the hospital, the doctor will see the child, and when the doctor sees the child, they will be the ones to know what to do. We don't tell you what to tell your doctors to do. That is wrong. A lot of people ask those kind of questions, and it's actually wrong. Okay, I don't want you as parents to start taking responsibility for what doctor should be doing. Like, what test should I tell my doctor to do? What should I tell my doctor? No, that is wrong. That if you don't have confidence in your doctor, then don't go to that doctor. Go to a government hospitals. Government hospitals have at least you can be sure the doctors in government hospitals are, most of them are at least, because the government hospitals kind of recruitment, they have to screen, they have to follow the due process. So you'll be sure that you likely meet a trained, well-trained doctor, because there are fake doctors, honestly. So some of you go to some of these hospitals who don't have doctors, and somebody maybe pretend to be a doctor, or they are quack doctors. So if you are not sure, if you're in that kind of scenario, then that is when you need to make sure you go to a government hospital. At least you are sure you are seeing a real doctor. That's number one. But you are not the one to tell the doctor what test the doctor should do for you or what you should not do. No, that is wrong. Let the doctor see the child, evaluate the child, and the doctor will tell you what to do. And then they will tell you what treatment your child needs based on the diagnosis. Because what you are seeing, sometimes parents think you know everything that is going on. There are many things that may be going on that you don't even think is a problem. But when the doctor sees the child, the doctor is the one that will pick it up. And that's why we cannot make diagnosis on you telling us this, line, and that, because there are other things that a doctor will see that you have not even thought of at all as something wrong. And that will be part of what will go into the doctors making the diagnosis and treating the child. So um, don't um, don't worry ahead. Just go to the doctor. The doctor will tell you what to do, and don't make assumptions. A lot of parents make assumptions. You think it's because of our teething. Teething does not make the child to have fever. Teething does not cause the child to have balls. Teething does not cause any health issues in children. Teething is a normal developmental milestone in children. So please, if your child is sick, I will not get tired of repeating this, because I don't know where that myth started from, but it's a very well believed myth. A lot of mothers believe it so strongly. A child is having fever, a child is sick. The first thing we think of is teething. Teething is the last thing you should ever think of in a child who is having fever, who is having boils, who is having rashes, who is having diarrhea, who is vomiting. That child is sick. So take the child to the hospital. Don't assume teething. Teething does not make children to be sick, and you don't need to give them any so-called teething powder and all that. So please take sick children to the hospital and don't give them unnecessary medications like that. The only thing you can give is paracetamol for fever as first aid. And if the child is not better, please, please, and please go to the hospital. All right. I think I'm okay with Instagram. Let me come back to Facebook. Onye Consola Deniji, good evening, ma'am. Maybe it's 9 months old, and instead of her to bring the down teeth, it is the upper teeth that came off first. There's nothing absolutely wrong with that. It is perfectly normal for babies to bring out the upper teeth first. I know there's a lot of beliefs. So for those of you who have all these beliefs, right? It's like today is about teaching myths and realities. There's actually an article on our website, at www.askthepediatricians.com. We have an article on teething myths. There are a lot of beliefs about teething that are wrong. And I think teething is one of those conditions that people just have a lot of wrong beliefs. I just addressed one, which is the fact that any child who is sick is because of teething. Number one, teething is completely an innocent bystander in many illness. The fact that a child is sick and bringing out teeth at the same time does not mean the teeth is what, or the teething is what is causing that illness. The illness is on its own, the teething is on its own. A lot of children have their teeth and you don't even know. You just wake up and you find the teeth in their mouth and they're okay. So teething does not make children sick at all. So if your child is sick and maybe incidentally was bringing out the teeth at the same time, does not mean the child is sick because of the teeth. So let's not forget that one out. Number two, those children, no child needs any so-called teething powder. No, don't give them baby Rex, pecan, bomoro, bona babe. Don't give all those dangerous drugs to your children. There is absolutely no need to give your child any of those so-called teething drugs. That is number two. Number three, whether your baby bring out the upper teeth first or the lower teeth first, it does not matter. It does not mean the child is a witch. It does not mean the child has any supernatural power or is demonic or whatever, because these are all sort of beliefs. So there is no law that it must only bring the lower teeth first. So most children will bring out the lower teeth first, but it is perfectly normal for babies to bring out the upper teeth first, and it is completely fine. And like I said earlier, some babies are not going to have their teeth until 1 year old, and it's completely fine. Whereas some babies are born with teeth, some babies are born even with their teeth in their mouth, and it's also completely fine. So there are differences, and it does not mean there's anything abnormal for those who have a different approach. So there's no reason why you should worry, and you should not use any negative words about your child. All those things are just myths, false beliefs, common beliefs that people believe, but there's nothing wrong with a child bringing out their teeth first. It's perfectly normal. All right. Fayintoluwa Adebayo Lawal, he tried 5 years on Epilim. Would take his drug at 8 a.m. in the morning, 8 p.m. at night. Can I change the time to 10 a.m. in the morning and 10 a.m. at night? Because of the new environment I have. Ideally, we want you to keep to the same timing, but if you have to change, you have to change. But I would rather you discuss that with your pediatric neurologist, whoever is following up the child, so that once you change, then you have to make sure you maintain the time again. So you have to change it and you have to maintain. So what time will the child be awake at 10 p.m. at night? Because we want the children to be sleeping at 10 p.m. So I'm not sure a 5-year-old should be awake at 10 p.m. I don't really think that's a good idea. A 5-year-old should not be awake at 10 p.m. So why do you want to change? It's better you bring it earlier. If you can do 7 p.m., 7 a.m. If you are struggling with school, they can give the child the drugs at school, or you give it first thing in the morning. What time do you normally wake up to start your runs? The child does not need to eat before they take their medication. So this child can take the drug 7 a.m. when they wake up, even when they're brushing their teeth, they can take their medication, and 7 p.m. I'm not really sure it's a good idea to be pushing a 5-year-old to be awake at 10 p.m. I really don't think that's a good idea, because you've not gone into the details of why you need to change to 10 p.m. If you tell us what is the issue, then I can tell you what to do. But really, I'd rather you move it earlier, or let the school give the medication, but definitely not a good idea to be giving a 5-year-old. An average 5-year-old should be sleeping at 10 p.m. They should not be waking up to take medication. So you may want to think about that. So there's no problem with changing, but we have to make sure we change it to something that you will be consistent. And I think most 5-year-old will be sleeping at 10 p.m. And it's not a good idea to be waking them up just to take medication at 10 p.m. So it's better to do it earlier than later. All right. Chikalu, my baby was said to have tongue tied today by a nurse when you went, but my baby cried. Well, if your baby is fine, please leave your baby alone, okay? Leave the baby alone. You don't need to worry yourself about the baby. Okay, there's a lot of unnecessary worry and anxiety about so-called tongue tie. All right. I cannot comment on tongue tie if I don't see the child. Obviously, I have to see the tongue. I have to see the move. So, but if you're not worried about your baby, just leave the baby alone. If you're worried, get a doctor to have a look at it, and then they can advise you properly. Chinaye, I'm not so sure what you're trying to type, but we can't make out any. Or is it another child that is typing that? I'm not sure what you're typing. All right, Chidima, Jennifer, please, how do I know my child has gained neck control? How old is your child? Always starts number one, start the question with the age of your child. A child will gain neck control from 3 to 4 months. And neck control simply means that when you carry your baby, their head, when you carry a newborn baby, you see their head going to the side, going forward, going backward. They have no control by it. But when they are 3 months old to 4 months old, when you lift them up, the head comes up with the rest of the body. It is not falling back. It is straight in the middle of the midline and with the rest of the body. So that is how you know. If you are not sure, just get to the hospital, let the doctors examine your baby. They will tell you straight away your baby's neck control is fine, or your baby's neck control is not fine. If you even in nurse, any of the health professionals can do that for you. But it is simple as the fact that the baby's neck is not falling anyhow to one side. Don't you carry the baby, they're able to keep their head straight, and in the middle, and it's not going to the side or going to the left or going backward. That is what it means to have neck control. All right, let's continue. Blessing Henry. Good evening. What do I do? My baby has measles when she was something months. So you've left out the keyword. How old was your baby when your baby had measles? And she'll be 3 years. The measles scar on her body refused to clear. That's not measles. So that's another issue. I don't like parents making a diagnosis of measles. All right, because most of the time we don't get it right. Okay, measles. Every rash is not measles. A lot of parents we get into all this. When we see rashes, it's either each rash, measles, or chickenpox. There are several other rashes that children can have beyond measles. Okay, so if your child has measles, the measles rash will not have a scar. Measles doesn't leave a scar. So measles tends to have what we call it maculopapular rash. In other words, there's like a little bit of swelling, and it will start from the what we call the hairline, and then it will go down to the rest of the body. And when the measles is going, it will peel. It will be like as if the skin is peeling. That is how rashes of measles look. It will peel off, and again it will start from the head again and peel off, and that is it. So measles does not give a scar at all. It's not going to leave any scar. It's just a peeling kind of rash that you have in measles. So it doesn't leave any rash. Even the chicken pox that tends to leave the round scars also clear quickly. Within 1 week, everything is gone. You may still see a little bit of the round stuff, that look whitish. But after a while, everything goes away. So if your child has scars on their body at age of 3, that is not measles at all. That is a different rash that your baby has. So I will recommend, which is why we strongly warn against you taking measles diagnosis from other fellow parents. They will just say, "Oh, your baby has measles. It's measles." It's not measles. Every rash is not measles. So if your baby is still having rashes on their body, 3 years, and it has something to do with measles, that child has a skin condition. You need to see a doctor, preferably a pediatrician. Let them have a quick look at your baby and tell you what is causing that rash or the scar, and then they will tell you how to treat it, and or if it's something that can be treatable, or whether it's something you just have to wait for it to clear on its own. But it is definitely not measles. That one I can tell you for free, that any rash your baby has now is not measles. Okay. Okay. Fine. Toluwa, say thank you. Okay, you didn't give us an update on why you are changing to 10 p.m., but it's okay. I guess you already know what to do. All right. Blessing, you are saying chicken paws. Okay, I don't know. Now you have gone from measles to chicken paws, whatever, but I really think you should see a pediatrician. Like I told you, if your baby has this, you didn't tell us at what age your baby has those rashes. But if your baby has the rashes when your baby were not even up to 1 year old, your baby cannot be still having those rashes or scars 3 years 2 years after, or when your baby is now 3 years old. It's very impossible. whether it's chickenpox, whether it's measles, it is none of those conditions. I can tell you that for free, because these are common conditions in babies. Children have measles, children have chickenpox, but they don't carry scars from them. No, they don't. So please, I will recommend that you get a professional opinion. Don't rely on your own or other parents' um, suggestions as to that. So I hope that is helpful. All right. I don't have any question on Instagram, I think. So I'm still here. We still have another 25 minutes or thereabouts to go. So feel free to ask any questions that you may have about the health of your children. I think a common theme that has come up today is that of teaching, and I hope we have gotten that sorted. Please, if you want to learn more about teaching, please go to our website. You can read about teaching there. Please, let's just take out that teaching diagnosis out of our out of the list of diagnosis. I know mothers will like that diagnosis a lot. Every little thing is sitting. Please, it's not sitting. And why it's so important for us as pediatricians to emphasize this is because um a lot of parents don't seek help on time. And for us as pediatricians, we are not God, eh? We don't have superpower, we don't have magic powers. So we need you to bring the children to us on time. And so when the children are sick, we want you to bring them to us on time. Because when you bring them to us on time, then we can do our best and hopefully the children will recover well. And but when we don't come to the hospital on time, children are very, which is why I like pediatrics. Children are very good in the sense that when you do the right thing, they get well quickly and they are fine. And you see your work, you see your inputs immediately. They are not like adults that even when they are getting better, they will still be pretending and be giving everybody the impression that they are not okay. But children are very, they don't pretend, they are not hypocrites and all that. They just, what you see is what you get. So when children are not well, they are not well. Immediately you do the right thing, they get better. But for adults, sometimes you're not sure whether they are just pretending. So if parents, however, if children are very sick as well, they can easily go down quickly. Children can go from 0 to 100 very quickly. So in other words, the earlier we take children to the hospital, the earlier we start the intervention, the better. And for me as a pediatrician, one of the things we notice why parents don't come to the hospital is because we make a lot of assumptions. Parents make loads and loads of assumptions about why their children are sick. So you are our first line doctors. We appreciate you for that, but please, you are not doctors, okay? So stop making your own diagnosis. Stop making assumptions. When children are sick, do your first aid, they have fever, give paracetamol, they have diarrhea, give ORS. But once within 24 hours, the children are not better, please bring them to the hospital. Okay, bring them to the hospital. Don't say, oh, it is sitting, oh, it is this, it is that. Because at the end of the day, when you make those assumptions, this is the problem with the assumption. When you make assumptions, you don't seek help on time. Okay, because if people have made the assumption that it's sitting, then you will rely on giving sitting mixture and not do anything. You will not come to the hospital, and that can lead to quick decompensation for the child. So we really, really want you to come to the hospital on time and not make assumptions so that we can quickly do what we can do and allow God to do his own part, and hopefully the children gets better. So if there's any message I really want to pass across this evening, is the fact that please, let's not make assumptions. And then when it comes to the rashes as well, we also make a lot of assumption with rashes. There are so many causes of rashes, and there are rashes that look alike and they are not the same. For example, measles rash, a lot of rashes also look like measles rash. Like, for example, a child reacting to antibiotics can have a rash that look like measles, but it is not measles, it is antibiotic reaction. So there are many other conditions that will look the same, but there are way doctors react to questions, and based on the questions they ask, they will be able to work out, oh, this is an allergic reaction, this is measles, or this is rubella. This is all this, So when it comes to rashes, let's avoid making assumptions as well. Let's just come and see the doctors, and the doctors will help us and tell us what to do. All right, so I hope we got that message. So feel free to ask your questions. I don't know, we don't seem to have many questions today. Please, if you are watching on the groups, you have to post your questions directly under the video, not in the group, because some of us post our questions in the group and I won't be able to say that. I'm going to just check now. But I will only see questions that are put directly under the video. So feel free to ask your question. And on Thursdays, watch out for ATP hour. And like I said, we should be doing something on World Oral Health Day. I'm not sure what the theme is now, but the 20th of March is the World Oral Health Day. So we should be able to have a teaching on that, hopefully soon. All right. So if you are just joining us, I can see some of you just joining us on Instagram. Welcome. Feel free to post your questions. If you have any question whatsoever on the health of your children, I still have a couple of quarter 20 minutes thereabouts to answer your questions, and we will do that. But if after the live session you have questions, please head over to our Facebook group and you can post your questions there. Okay, I have a question from Instagram. How can I make my 10-month-old plus eat other food? That's a very, very big question because that's one question mothers like. The truth is, matter is that you can't force any child to eat whatever they don't want to eat. You will just have to encourage them. She'd rather take breast milk, and that won't satisfy her definitely. So at 10 months, in fact, from 6 months, breast milk is not enough. So your child needs to eat other food. All right. Obviously, most children don't like it's just like I always tell parents, just like if you're Nigerian, you go to another country, different culture, different everything, you're not going to. Some of us are very adventurous, so anything they put on your plate you will eat, but some of us, we're also very careful, and like it will take you some time before you can try those new food and all that. The same thing with children. So when we're introducing new food to them, we need to just be patient, and we need to use a lot of tips and strategies. Some of us just assume that you just give them those food and they just start to eat it immediately. No. So you need to start it gradually, and you need to be patient. So when you are introducing new food, number one, just give a little bit at a time. Like when you are eating your own food as well, let's put a little bit of it in your child's mouth. Let them start learning to eat the same food that you are eating. You practice with that, okay? And then you gradually increase. Then let's offer variety. Okay, some of us, we just want to give the children pap and only pap or any of those cereals. There are like hundreds of food. Every food that you eat, your baby can eat it. The same thing you eat, the swallow, the potato, the yam, the veggies, and all that. So you have to try different things, and even the way you offer the food. Okay, make sure you offer the food in a pleasant way. Use colorful plates and spoons, and like there are like 5 or 4 all different way you can prepare rice. You can also mix things. The most important thing is that when you are starting at this age, you start with soft texture like porridge, like then you graduate to more of the solid by the time they're about 1 year old. So if you go to our Facebook group, we have what we call a guide session. We have a guide on complementary feeding. There are lots of videos there that will give you all these strategies on how to offer food. And of course, patience and persistence is always important, because most of us, we give up quickly. You give the child the food one day, the child didn't take it, then you say, oh, the child doesn't like that food, that's it. No, you have to offer and over and over again. We said at least you must have offered it 13 times. That is 1-3. 13 times. That way, tell parents at least you must be offering that food for 1 week before you will say, okay, the child doesn't like this, okay, and then you try something else. So, and you don't have to always buy, you don't have to buy anything from the shops. Use your own food in your own kitchen, and make sure you eat at the same time with the child. Let the child see eating as something nice, something pleasurable, not as a punishment. Not like you want to don't force feed your children to eat. Okay, you eat at the same time. Everybody is eating. Let the child see that everybody is eating the same thing, and then they will be happy to eat it. And you try it. And please don't make children's food too spicy, not the pepper. And no, the children don't need, there's no calorie in that pepper, so they don't need much of that pepper. Also, the food must be tasty. Some of you will make food no salt, no sugar, because all the meats that you should not put salt, you should not put sugar. How would the child eat the food that doesn't have taste? Because I'm sure you too, you will not like it. So these are things like the porridge has to be thick, it should not be like watery. Don't give complimentary food through bottles and all that. It has to be through plates, colorful, nice, present. The child, when they see the plates alone and the color and everything, they will be interested in eating. So these are strategies. But of course, like I said, some children are fussy eaters, so they will be more challenging than the others. So you have to be patient, but you keep trying and keep adding more and more food. Variety is very important. Don't just keep giving only one meal. Try different things, and then hopefully the child will get to the point when they can eat. So that's all. There's nothing like one food to introduce. The child should be eating variety of food. So, Kafila, I hope that is helpful. If not, like I said, please watch all those videos. We have a lot of videos on complementary feeding made by Global Health Media. You can search for the videos also on YouTube. They also have an app, Baby Birth and Beyond app, where you can watch all those videos. They're available in your local languages and all that. So, there are lots of resources online. Just have to go through them and start using all these simple strategies. All right, Chumsy 296, you're exclusive breastfeeding my baby, but I notice it's not enough for him. How do you notice it's not enough? Because there are times he wants more food. How do you know you want more food? And seem the milk is out or not. Okay, so Chumsy, the only way you will know your baby is not getting enough milk is if your baby is not gaining weight. Okay, so baby sucking is not all about food alone. There are many reasons why babies want to suck and suck and suck. Baby do not suck only because they want to eat, okay? So babies suck to eat, of course, but they also suck just for comfort. Sometimes they just want to be near their mother. Sometimes they just want to feel you. They want to feel that warmth. They want to feel that security. So it is not because baby is crying or the baby wants to stay on the bed on the breast 24/7 that the baby is not getting enough milk. No, that is not the way we pediatricians know whether a baby is getting enough milk is to put your baby on the scale. If your baby is gaining weight, that baby is getting enough food, because the baby who is not getting enough food will not gain weight. So if you want to ask me this question, well, the first question I want to ask you, how old is your baby? What is the birth weight of your baby? What is the current weight of your baby? So you go for immunization at 6 weeks, 10 weeks, they weigh your baby. So if they weigh your baby is gaining weight steadily. That baby is getting enough food. Do not give water, do not give formula, give your baby only breast milk. Babies who are twins can be exclusively breastfed. So there is no way you will say you don't have enough breast milk for your one baby, even babies that are twins, because as babies suck, the body produces more milk. So mothers, you have excess milk to give to your baby, and you can breastfeed, you can express as well. So your baby is sucking all the time. It's not only some of you, even if you notice, some of you, your baby will suck to the point that they are even vomiting. As by they are so full, the tummy is so full, and they are vomiting, they will still want to suck. That is to tell you that sucking is not just about food. It's not because baby wants to eat that baby keeps sucking. So your baby has sucked, you should be able to feel their tummy. You will see the tummy is full. You will see that your own breast is empty. That baby has gotten enough food. So depends on baby wants to. There are other ways you can comfort that baby. You don't always have to say, oh, I have to put the baby on the breast 24/7. Most babies will suck for 10-20 minutes, they will be fine, and then they will suck every 3-4 hours. So there's no way your baby wants to suck 24/7. That is not about food. That is about something else going on with that baby, and that baby wants to use the sucking as a comfort, as a pleasure, as something else. So you have to know that everything is not just about food. All right, so if your baby is 2 months old, just keep breastfeeding your baby exclusively. Okay, today I'm not going to go into all the details, but there are loads of benefits for your baby being breastfed exclusively And the most important thing is that your baby will be, will be healthy. When you start giving for water formula, you are inviting infections, you are inviting other issues, and then you start going to hospital, baby becomes sick and all that. So the best way to feed your baby for the first 6 months is breast milk only. And trust me, it is enough for your baby. Okay, it is enough for the baby. So that's all you need to do. And the way put your baby on the scale, and the baby's weight will be going up. That baby is getting enough. So that is how we know, and that is what we recommend for you. I hope that is helpful. Just let me know if you want any further clarification. All right, let's go to Facebook. My baby is 13 months. Now you're walking. Should I be worried? No, you don't have to be worried. Yes, most babies will walk at 1 year, but some babies will not walk at 1 year. Some babies will walk at 13 months, some people walk at 14 months. I will only worry if your baby is not walking by 18 months. Okay. So pediatricians say wait until your baby is 18 months, and then that is when you will know whether your baby is weight. I mean, your baby will be, that is when we will worry about your baby's not walking. So just give baby some time. So is your baby standing, your baby crawling, those are the things I'm interested in. If your child is already crawling and standing with support, holding table, walking around table, cruising as we call it, then that baby is fine. So, but if by 18 months your child is not yet walking, then you have to come and see the pediatricians for further evaluation. Okay. All right. So your baby is 15 months. Okay. 15 months. Again, we wait until your baby is 18 months, and then you can come and see us for further evaluation. But don't worry. Is your baby able to do all the milestones, that come before walking, like crawling, standing with holding to support, cruising around the table? If your baby is already doing that, then most likely the child will soon be walking. But if your child is also not crawling or not sitting, and then that one you have to come and see us immediately. But otherwise, baby is doing all the other ones, just only walking remaining. Wait until the child is 18 months, and then we'll see the baby. All right. Chamsi say your baby's birth weight is 4.6. Your baby is too big, okay? All right. So I hope your baby was evaluated at birth. All right. So any baby that weighs more than 4 kilos at birth is too big. We call it macrosomic babies. We tend to see it in babies whose mother has high blood sugar and all that. Anyway, some babies are just big, maybe because they are big in their families and all that. So make sure, but it is important that a pediatrician should check your baby, make sure you are fine, make sure your baby is also fine. Your baby at 6 weeks is 5.9. That's okay. 5.9 is more than okay. So just keep breastfeeding your baby exclusively, and they need to actually keep track of your baby's weight, okay, because there are some conditions that make babies to be very big at birth. We don't want babies bigger than 4 kilos when they are born. So if they are more than 4 kilos at birth, we worry about other conditions, and we need to make sure there are not of any of those. So that is where the pediatrician comes in. But like I said, it may just be normal, especially if everybody in your family is big and all that. But we need to keep an eye on that. So that just keep an eye on that, and just keep breastfeeding your baby exclusively. All right, Sarah is updating. Say your baby is already doing the milestones before walking. Okay, fine. Baby is already doing the milestones before walking. Just watch and wait. Like I said, by 18 months, we expect most babies to start walking. If your child is not walking by 18 months, then we can now start to think, is there something going on? Is there something wrong? But most of the time before, some children will still not walk at 18 months, but we at least at that time, we will begin to look at whether there are reasons for the delay and whether it's something we can fix or not, and we'll let you know about that. So that's what we normally do. All right, so I think we are coming gradually to the end of today's episode of ATP Monday. I'm always happy to be here on Mondays answering your questions. But like I said, if after the live session or if you are just watching the recording, like you're watching after 7 p.m. on a Monday, Nigerian time, then you are watching the recording, then you need to go to Ask the Pediatricians Facebook group, and that's where you can post your questions, and we will be there to answer your question from Mondays to Saturdays, 24 hours every day. We are there to answer your questions. On Thursday, we do a teaching. Thursday, 10 a.m. West African time. You can also watch ATP Hour. ATP Hour is not for question and answer, it's a teaching section, and we talk about different topics that are important when it comes to children's health. All right, I got question from Lillian AC Moon. My baby of 1 month old poo is watery, really, and always struggling to poo. I see the poo is very strong, and he poo almost 5 times with 4 to 5 hours space. Okay, number one, newborn babies don't pass hard or thick stools like adults. So they tend to pass what we call semi-formed stool. That's it. We don't call it watery. We call it semi-formed, and it looks like some water with some solid parts. Like if you are in Nigeria, you are familiar with what we call melon soup or egusi soup. So you have some solid parts and some liquid parts mixed together. That's the kind of stool you get in newborn babies, in new first 1 month old, and that is perfectly normal. That is not watery. Watery stool in a newborn babies will be like completely like water, like urine, like you won't see anything at all. So it will just be complete water, and it will sink completely into the diaper. So that is when we say it is watery for a newborn baby. But if you can see some solid and some liquid, that is normal for a newborn baby, and that is not watery stool. Okay, so that's number one. Number two, babies make all these straining sounds that they make when they're passing stool, even though, like you said, the stool is soft, it's not hard. It is completely normal. It's nothing to worry about. So it does not mean they're having constipation. It does not mean the stool is strong. It is just a because babies at that age, they are very sensitive to everything passing through their body, so they kind of react to it or get surprised by it, so they make all those twisting, all those sound. It's perfectly normal as long as the stool being passed is soft and not hard, so you don't need to worry about that. Number three, your baby can pass through up to 12 times a day normally. Okay, so 4 to 5 times is still within normal. There's nothing absolutely wrong with that. So baby can actually pass through every time they suck. So some babies, that's why some babies will pass immediately they start sucking the pastules, or after sucking the pastules, and they can pass it up to 8 to 12 times a day normally, and that is not diarrhea, and that is not too much. That is normal limit. So everything you've said now, even though you didn't really clarify the word three parts, sounds particularly normal. But the most important thing is that you are feeding your baby appropriately. So your baby should be on breast milk only, no water, no formula, just breast milk only, and then the stools will be fine. Okay, so like I said, but if your baby's stool is completely watery like urine and you can't see anything on top, it's like everything sticking to the diaper, then that is watery, and that is where we worried. And then again, the boils down to what are you feeding this baby with. So we want you to feed the baby with only breast milk, and their stools will be normal, and there's nothing to worry about. So I hope that is clear for Lillian. One question also on Instagram: 22 months old daughter tiptoes most of the time. She started walking at 1 year and she has hit other milestones. Should I be worried? We don't worry about tiptoeing until the baby is 2 years old and above. So if your baby is tiptoeing at 24 months and above, then we will start to worry, because tiptoe walking can be seen in certain conditions. But you say your baby is hitting other milestones, so it may just be one of those habit thing that's going to come to pass. But if your child is persistently toe walking after 2 years, you have to see a pediatrician. Okay, we need to make sure there's nothing neurological going on. We want to make sure the child doesn't have autism, because those are the conditions where we tend to see persistent toe walking and all that. So, but if the child is otherwise fine after 2 years, there's so maybe it's 22 months now, so just keep an eye on it for another 2 years. But if your child is persistently tiptoe walking beyond 2 years, you have to see a pediatrician for further evaluation, and then they will tell you what to do. All right, I hope that is clear. Thank you so much. My time is up. I gotta go. So thank you so much for all of you who have asked questions today, and all of you who have watched, even though you don't have any questions. How many times in a day do I feed a 6-month-old? If it's on complementary feeding, okay, our time is gone, but I'll just answer that in 1 minute. A 6-month-old should be sucking breast just as before the baby starts complementary feeding. So your baby should be sucking on demand, and then you can add 2 complementary feeds. That is what we start with at 6 months old. So just 2 complementary feeds a day, and the baby is sucking breast as of before. So breastfeeding not reduced, but then you had 2 feeds of complementary feeds in 24 hours. So if you want more information on complementary feeds, please go to um, our Facebook group, Amaka. If you go to our Facebook group, Ask the Pediatrician's Facebook group, there is a guide section. So that guide section is one of the menu. If you go to the guides, go to guide 2. We have a lot of videos, articles, posts on complementary feeding. That all these things are very well clearly spelled out, and you want to watch it, you have all the information that you need to be able to do complementary feeding appropriately. So that is that. Okay, so thank you so much. My time is up, Chomsy. I won't be able to talk about your big baby today, so maybe another time. um if you still have any questions, though, feel free to go over to our Facebook group from Mondays to Saturdays, 24 hours daily. Post your questions there. Myself and my colleagues, my moderators, will be there to answer any health questions that you may have. And remember to join us on Thursday, 10 a.m. West African time for a fresh episode of ATP Hour, where you can learn as we talk about important issues that affect the health of our children. Thank you so much for joining me. Have a wonderful evening. It's bye from me. Bye.